Hello from Boulder, Colorado. I hope all of you are having a great week. We actually just learned that one of our team members got engaged over the weekend, so it's been quite a happy week over here. My name is Arielle Scott, and I am lucky enough to be running marketing at Good Belly Probiotics. Besides offering highly effective probiotic drinks to our community, we love to provide information and resources on some of the topics we find to be most relevant to all of you. We are extremely pleased to see you all signing in from every corner of the country. There are actually several hundred of you attending, from doctors to dietitians to those who are simply looking to maintain your own digestive health over the holiday season. Today's webinar will run about 30 minutes and will conclude with a question and answer session. Throughout the presentation, if you have any questions at all, please feel free to submit them on your GoToWebinar dashboard. We'll be collecting them along the way, and we'll make sure that all of your questions get answered by the end. During the first 20 minutes or so, we will be hearing from a very special guest speaker whom I will introduce to you shortly. During this time, she will teach us about the following topics. First, the importance of overall digestive health. Second, how our digestive systems can be compromised during the holidays, perhaps more than any other time of the year. Third, best ways to avoid these problems and how to stay healthy instead. Fourth, the top foods to maintain a healthy digestive system. And last, but certainly not least, the benefits of probiotics in this context. It is my absolute pleasure to introduce you to Dr. Roshini Raj, who is calling in from New York City. Dr. Raj is a board-certified gastroenterologist. Many of you may recognize her from the Today Show, where she recommended Good Belly to Today Show's audiences a few months back. She is also the Good Day New York medical correspondent and the medical editor of Health Magazine, an extremely active member of the medical community and media. Without further ado, please let me welcome Dr. Raj.
The holidays are upon us. I think with Superstorm Sandy, I think they came even sooner than anyone had anticipated. Thanksgiving is next week, and of course the winter holidays are coming in December. So how can the holidays affect our digestive health? Well, there's a lot going on during the holiday time that can really affect how we eat, how we function, whether we travel, and all of these factors can really affect how well our digestive system is functioning. So first let's talk about diet. Sorry, there we go. Of course, everyone wants to indulge a little bit during the holidays, and certainly the alcohol is flowing freely, and people are generally eating larger quantities of food, but also richer foods, less healthy foods. And so why is this an issue? Well, certainly for someone who suffers from acid reflux, we generally do recommend trying to limit their alcohol intake, as well as acidic foods, caffeine, chocolate, citrus as well. And during the holiday time, it's not always easy to avoid, chocolate desserts or the wine. So this can sometimes put someone with acid reflux into a bad spell. Generally, one of the things I recommend is to really make sure that the person is taking their medication appropriately. One of the things that happens during the holidays is people tend to stop medications. Their schedule changes. They don't remember to take it. And with acid reflux in particular, we have now noticed that there is something called an acid rebound effect, so that someone who is taking an acid reducer chronically, when they stop taking it, especially if they stop abruptly, they can experience a rebound surge of acid, so that they experience an even higher level of acid than they normally would have had they never taken any medicine. So this is something to warn your patients about going into the holidays, and really counsel them that if they are on a regular regimen of an acid blocker, they need to continue taking it. They also need to, as much as possible, really try to stick to their low acid diet, and that includes lifestyle factors like not eating very late at night and going right to bed, because when we lay down, gravity actually is not helping keeping the acid down, so acid is easily transferred up into the esophagus area. So these are just reminders you need to keep your patients aware of. Now, for patients who suffer from irritable bowel syndrome and particularly constipation, fruits and vegetables are a key part of their regimen in keeping them regular. And unfortunately, during the holidays, sometimes this goes by the wayside as well. So just making sure that they do try to maintain a high fiber diet despite they might be traveling, not in their usual surroundings, really trying to seek out high fiber foods or even taking a fiber supplement is very important. People who have celiac disease often find the holidays to be very difficult, especially if it's a new diagnosis. Their family and friends are not used to preparing gluten-free meals. You know, Thanksgiving is often a loaded issue for people with celiac disease, but it's really important that they do make everyone aware, whoever's cooking, of their dietary restrictions, and maybe they can bring their own dish to the holiday meal, because for someone with celiac disease, depends on the severity of their symptoms, but they can really feel significant discomfort if there is any gluten in the meal that they ingest. And it's not only a matter of how they're feeling, but it can cause significant inflammation in their intestine. So it's important for those who have dietary restrictions, specifically celiac, but also things like lactose intolerance, food allergies, that they keep these in mind, make everyone aware of them, so that they don't end up suffering after a holiday meal. In terms of lifestyle during the holidays, this is the season of parties and late nights, more alcohol as we mentioned. But sleep deprivation is one of the main factors that can really affect not only overall health but gastrointestinal health in general. Several recent studies have shown that those who are sleep deprived tend to crave fattier foods. They eat more, actually, than they normally do. They tend to gain weight when they're sleep deprived. It also can, affect your circadian rhythm, which can then affect your bowel movement regimen. So people can become constipated because of sleep deprivation. So it is important as much as possible to try to maintain a routine. And, people think that taking naps can kind of make up for a sleep deficit, but that really hasn't been shown to be the case. For the most part, as much as you can to stick to a regular bedtime and a regular wake-up time is really the most important in maintaining your overall sleep health. So those are things that can affect your GI health and need to be looked at carefully. Stress, unfortunately, can play a big role during the holidays, although this is supposed to be, a very fun and happy time. Sometimes it involves seeing relatives that, relationships might not be ideal, seeing people that you don't normally see and have to deal with. That can be very stressful. Just the stress of all the commitments that come up during the holidays. So parties during the week, when you have to work the next day, taking care of relatives during the holidays, traveling to far-off places to see relatives, all of this can cause stress. And we know that GI conditions in general, much more so than many other parts of the body, can really be impacted by high stress levels. So irritable bowel is the perfect example of a GI condition where the same neurotransmitters, the same chemicals that are released in our brain when we are stressed or anxious actually can affect the walls of our intestine and can cause them to either slow down for people who suffer from IBS with constipation, or actually speed up for people who have IBS with diarrhea. So trying to control that stress as much as possible is very important. Meditation, yoga, acupuncture, deep breathing, these are all things that have been shown to have a benefit in irritable bowel. And certainly if the stress level is severe, talking to a therapist or psychologist or psychiatrist can help. We, in fact, sometimes use antidepressant medications to treat irritable bowel, even if the person is not clinically depressed, because there has been shown to be some efficacy in that situation. The other thing that can happen during the holidays is that people are exerting themselves in new and unusual ways, whether it's shoveling the snow or reaching up to, put the star on the Christmas tree and exerting certain muscles that they don't normally use, lifting heavy luggage when traveling. This can lead to aches and pains, which can then lead to the use of non-steroidal anti-inflammatories. medications such as aspirin, ibuprofen. These are medications that can really wreak havoc on your stomach lining, leading to gastritis and even ulcers. And this can happen with occasional use and is definitely more of an issue with heavy use or chronic use. So this is something also to kind of counsel your patients about, that they need to be careful when they are using those types of medications. Using it with food generally is better, but still not completely safe, and to try to really use them in moderation. Tylenol is absolutely safe for the stomach, so if that is an option, that should be the first choice. And so these are some of the preventative steps you can counsel your patients or your clients about, and you're using in your own life as well, trying to mitigate some of these factors. So if you know that you can't really carry a heavy piece of luggage, ask for help. Don't overstrain yourself. If you know that you're going to be walking into a stressful situation with family members, trying to do some deep breathing exercises beforehand, or honestly trying to avoid certain situations that you know are going to cause you undue stress can really help. Maintaining a sleep pattern is very important. And exercise is another thing that people often forego during the holidays. They don't have time, they feel, or it's cold out, they can't do their usual exercises. Exercise is actually very important in maintaining gastrointestinal health. It really helps with regulating bowel movements, the processing of gas, and people with irritable bowel feel better when they exercise also because it helps to reduce stress. So really trying to maintain some kind of exercise routine during the holidays, during travel as well, is very important. All right, so what can we not control during the holidays? What's not up to us? Well, colder weather, of course, comes, and I mentioned the impact on exercise that can have. People also tend to be a little bit more constipated during the cold weather months, and part of this has to do with, I think, diet changes and lifestyle changes, but it also seems to be a phenomenon that occurs just due to the cold itself. The darker days, can affect people's moods, and again, can cause sometimes, in severe cases, seasonal affective disorder. But for everyone, it can cause a little bit of a depression mood situation, which can then also affect GI health. Certainly, the cold weather causes people to be congregated more indoors, which then can lead to transmission of viruses such as cold and flu. Some of these can have GI effects as well. So certainly several forms of the flu virus can cause GI upset, nausea, vomiting, diarrhea, usually self-limited, but can cause some distress as well. So how do you prepare yourself and your family for this? Well, in terms of the cold weather, not too much you can do, but getting outside actually is important when it is light out, because you don't want to be just shut in the entire winter. That leads to just a more sedentary lifestyle in general, which can then affect, your GI health, especially bowel regularity. So trying to get out for brisk walks during the sunlight time is important. I think in terms of transmission of viruses, hand washing is extremely important and is probably your best way of preventing catching a cold or the flu. And of course the flu shot as well, very important. Recently there's been a lot of news about different conditions that are associated with the flu. Just this week, one study showed a link between flu during pregnancy and autism. So just a million reasons now why everyone should be getting the flu shot. Basically anyone 6 months or older should be vaccinated, and that can help not only upper respiratory symptoms, but GI symptoms as well. All right, well, traveling. One of the fun parts of the holidays is most people have some time off and they can go travel. Or they may even just go travel for an evening or two to visit some friends or go to a dinner party. Traveling is really interesting in terms of your gastrointestinal tract, because it seems that traveling, even if you do eat the same foods, has an impact on bowel regularity. Part of it may be that people are in different surroundings. They're not as comfortable with the bathrooms that are available. But many people do report a change in their bowel habits when they travel, usually tending towards constipation. Diet definitely plays a role in this. So, most people aren't as strict in terms of diets when they are traveling. They feel like they're on a little, vacation from the healthy diet, so they don't maintain as many fruits and vegetables. If they have some dietary intolerances, they're not as strict at avoiding them. So this is something to look out for and really try to be aware of when you do travel to maintain your healthy diet as much as you can. Time changes can also affect circadian rhythms, which then can affect your bowel movements as well. So that's something to be aware of. Exercising when you're traveling is not always easy. You don't have your regular gym available, but walking is a great form of exercise, and if at all possible, going for a walk every day for at least 20 minutes can really help maintain overall health, stress level, and GI health as well. And there are other activities certainly that can be done in the winter, skiing, snowboarding, all of these things can really help. Sick family members, not always easy to avoid, but hand washing, of course, is very important. And one of the things that, when people travel during the winter, sometimes they do travel to more exotic, warm locations, the Caribbean, South America, and, one of the issues here, of course, is avoiding a diarrheal illness, some kind of parasite or bacteria picked up when you're traveling. And here again, hand washing is key, but also being careful about what you're eating. Trying to avoid raw produce where you're not 100% sure how well it's been washed. Cooked foods generally are safer, but also trying to avoid eating food off the streets, eating in reputable restaurants, and again, hand washing should help. And I should mention, since we are talking about probiotics today as well, taking a probiotic can also help maintain the balance of bacteria in your intestines so that you are hopefully a little bit better able to fend off some of these bugs that you can be contaminated with when you are traveling. Okay, so overall, what can we do? Oh, let's go back one. To maintain our digestive health during this season? Well, eating the right foods, of course we say this all year long, but it's, I think, even more crucial during the holiday time when there's so many temptations trying to lead us astray, that we do really try to maintain our healthy diet, which includes plentiful fruits, vegetables, whole grains, sources of fiber, trying to avoid, if you have an acid reflux condition, the highly acidic or acid-prone foods, which includes anything with caffeine, tomato, citrus fruits, chocolate, very fatty, very greasy foods, and peppermint. Alcohol and smoking, of course. Smoking we don't want to do at all, but it definitely makes acid reflux worse, and alcohol can make it worse as well, so we would like that to be in moderation. Maintaining a healthy weight. So this is a time of year where many people gain weight. They're not exercising as much. They're more sedentary. They're often eating more fatty, high-caloric foods. The cold weather tends to make us crave those types of foods more. But it's really important to watch what you're eating and what you're doing because gaining that weight can be very difficult to lose, once the summer comes. Maintaining exercise, I've said it over and over again, really important. Avoiding tobacco is crucial for overall health, but actually can affect your GI health in particular. Alcohol as well. In addition to acid reflux, significant alcohol use can cause gastritis, which is inflammation of your stomach, so you really want to keep an eye on that. And I think managing your stress is really important for, again, overall health, but also GI health. There is definitely such a thing as the gut-mind connection. As I mentioned, those same chemicals that work in your brain work on your gut. So you really want to keep those stress hormones at a low level if possible. So what are the good foods? I told you what to try to avoid. What's good for you? Certainly fruits and vegetables, the high-fiber foods that we mentioned. Beans are great. Certain types of ginger, cinnamon, peppermint, certain herbs and spices have been found to soothe certain GI conditions. Peppermint tea can be great for nausea, not good for acid reflux, but good for other GI conditions. Ginger is great for nausea, bloating, cinnamon as well. And probiotics, which we know are the good bacteria. We're now finding that the bacteria are in our intestines. Some are not good, and some are actually quite beneficial. And when we alter that bacteria, whether it's because we've traveled or we've taken antibiotics, or sometimes it changes and we're not sure why, it can affect our overall GI health. It can cause bloating, diarrhea, maybe even irritable bowel. So restoring that balance by taking a good bacteria back into your digestive system can be beneficial. And a little bit more about probiotics. You know, we know that we have millions of bacteria in our intestine. In fact, walking around, we have more bacteria than human cells in our body. So the thinking has really come around in the last couple decades that we used to think of bacteria as always the enemy. We now find that it's often our friend, often has protective effects. And, you know, there's even some theories that all the hygiene that we're doing in terms of Purell and you know, always trying to get rid of bacteria may be part of the cause of even, you know, the rise in allergies we're seeing in children, rise in conditions like inflammatory bowel disease, and even the obesity epidemic may be in part due to an imbalance of bacteria that we've caused by the overuse of antibiotics. So replenishing our good bacteria is very important. Trying to, oh, here we go. So probiotics, which can come in many forms, can be confusing, I think, to the consumer or the patient because there are many out there and it's kind of hard to figure out which one is right for you. I think it always warrants a discussion with your healthcare provider to help guide you. But, you know, many people like to get it in some form of food. So Good Belly comes in a shot form, a juice form, and you can also take it in a pill form, in a yogurt, kefir. There are now many options other than just in yogurt and other than just pill. One thing that patients get confused about is which strain should they use. You know, should they have 1 billion bacteria there or 3 billion? You know, is it better to have a mixture of different ones? We're still learning a lot about probiotics and which is the ideal mix, or whether you should have an isolated strain and which health conditions it actually works for. I think overall digestive health, it is important to maintain your bacterial flora, but I think we're still, you know, doing research on which particular strains are the best for you and how much to take and when. So to end the lecture, the top 5 tips I would have for this holiday season in terms of maintaining or promoting your digestive health would be to try to maintain a balanced diet, keeping your weight in check, exercising regularly, keeping alcohol in moderation, and really trying to reduce the stress as much as you can. And for more on me and what I do, you can go to my website or follow me on Twitter at Dr. Roshni Raj. And to learn more about Good Belly and probiotics in general, you can go to their website, which is goodbelly.com.
Thank you so much, Dr. Raj. I really appreciate the time you spent on that. And for all of you around the country for taking time out of your busy schedules for this informational webinar. Before we get to questions, as Dr. Raj mentioned, this slide just outlines a few links that might be helpful. And I don't know if you've seen Dr. Raj's website before, but it's definitely worth navigating around. It's just got so much good information on there. As for probiotics, our colleague Cassie posted some delicious holiday recipes for you on our blog that feature Good Belly, and there's even an egg-free version of eggnog with probiotics, and it just tastes absolutely delicious. So there are creative ways of getting your probiotics into your holiday meals as well. So just visit goodbelly.com, and then you can scroll down to the bottom right corner where you'll see an image of that probiotic eggnog. So now on to questions. We've gotten a whole bunch of them, and I'm just sifting through them right now. The first question is for Dr. Raj to possibly cover any helpful information for those who have Crohn's disease specifically.
Well, Crohn's disease can vary in severity and location of involvement, whether it's, and just for those of you who may not be familiar, Crohn's disease is a chronic inflammation of the colon and or small intestine. And basically it is treated with a variety of different medications, really depends on the patient. I think what's crucial in Crohn's disease is that the person continues their medication. I mentioned how sometimes people forget to take their medicines. In a condition like Crohn's disease, it's especially important to continue maintenance medication, even if you're feeling well. Alcohol is something that should be definitely kept in moderation, if not avoided altogether. That's something you can discuss with your doctor. Avoiding the pain medications, the nonsteroidal anti-inflammatories is very important for people with Crohn's disease. And again, Crohn's disease in terms of diet depends on where it's located. We sometimes recommend a low-fiber diet just because there may be some narrowing of the intestine. But, whatever diet that you have discussed with your doctor and your nutritionist, again, very important to maintain it because certain foods can trigger a flare for people with Crohn's disease. And stress, although studies are mixed on this, many of my patients report that when they are stressed and sleep deprived, that is what can trigger a flare for them, a flare-up of their Crohn's disease. So maintaining stress is especially crucial in this situation.
Great, thank you. Now, the next question that comes in is something we've gotten a lot, and I would love for Dr. Raj to speak to this. The question is, can you address GI cleanses, and if there's a best option on the market?
Yeah, so GI cleanses, which can come in, I think, a couple different forms. There's some cleanses where it's sort of a cleanse that you take orally, so you only drink lemon water or juice, and then there are these colonics that you actually get irrigated in the colon. So I guess I'll address both of them. Both of them I don't really believe are necessary to your GI health. I think that your GI tract does a good job of cleansing itself. And if it doesn't, it's something you need to talk to your doctor about. But generally, if you have a high-fiber diet, which we all should be striving for, then your GI system is being cleansed. If you're constipated and you feel like things are backing up and building up, you need to talk to your doctor about that. But I don't believe that the cleanses or the colonics make any difference. And I have, in fact, seen the opposite effect where people who have taken a certain cleanse, sometimes they involve taking multiple pills, or have developed GI upset and sometimes even inflammation of their colon. So, and in terms of the colonics where someone's inserting something into your rectum, I always am fearful of people doing that when it's not a trained doctor administering it. So I really would avoid both of them.
Thank you. The next question is Good Belly related. It says, how will Good Belly help my IBS? Now, because we are a beverage as opposed to a medication, we can't make specific claims around a cure to any sort of health condition. But I can tell you that the probiotic used in Good Belly has been researched just vastly for the last 15 to 20 years. And specifically around IBS, this particular strain was just actually reported on for a clinical that was done in India. So if you look up Lactobacillus plantarum 299V or even just LP299V, you could probably find the pretty tremendously successful results in just by our friend Google over there. Okay, so the next question is, I live with no colon, chronic diarrhea, and dehydration. And then there's a little side note, yeah, Good Belly. Any dietary suggestions, Dr. Raj?
Can you repeat that? Did they say they live with no colon?
Correct.
Okay. So, I mean, this is a specific situation for a specific person that I don't think is going to apply to everyone, and I don't generally like to comment in this kind of forum on people's specific GI conditions because, you know, not having examined someone and heard their whole story, it's very difficult to make recommendations. But, you know, generally for someone who has no colon, you know, part of the job of our colon is to absorb the water that's in our stool, because when our stool is in our small intestine, it's liquid. When it gets to the colon absorbs water, so it becomes more formed and solid. So it's certainly not surprising that this person is having diarrhea because they don't have a colon. Really would have to talk to your specific doctor about dietary things that can be done, as well as sometimes bulking agents that can be used to try to firm up the stool. But unfortunately, without really knowing you, seeing you in the office and hearing everything and examining you, I won't be able to give much more than that.
Thank you. So the next question is IBS related as well. It says, I have IBS and cannot tolerate high fiber foods. I take an acacia fiber in water. Does this take care of the fiber I need?
That's a good question because, yeah, we talk so much about the importance of fiber, but there are many people with IBS who don't tolerate fiber well. It causes bloating, pain, sometimes diarrhea. So this is kind of a common issue. And, yeah, I don't know exactly how much you're taking of that fiber that you mentioned, but I would say that, in your specific case, or people who are not tolerant to fiber, it's really a question of trial and error, which fibers you can tolerate, which ones you can't, and any fiber is certainly better than none. So I would, continue taking what you're taking. Is it enough? It's hard to say in terms of there is a daily recommendation of how much fiber you should be getting, and chances are you're probably not, but you have to balance that with the IBS and the way you feel when you have a lot of fiber. So that's a bit of a balancing act that you're going to have to undergo, and with the guidance of your doctor as well.
Thank you. They are just coming in, so we'll just keep on going. The next one says, taking a cranberry supplement daily that claims it is a probiotic as well as it is providing preventive health. What is your take on this? And I also have lactose issues. Is there any reason for Lactaid tablets as well as cranberry tablets to not work as well or react negatively to one another?
I don't see any reason why Lactaid pills would be less effective if you're also taking cranberry supplements. I don't know the supplement you're talking about, so I'm not sure if it has a probiotic in it or not. Generally, people take cranberry supplements to promote urinary health. So if you're someone who's prone to getting frequent urinary tract infections, some people think that taking regular cranberry supplements can help prevent further UTIs. But beyond that, I can't really comment on it.
Okay. And then we have a few gluten-related questions. One individual is describing reacting poorly to beer. And overall, Dr. Raj, what is your recommended approach for people who believe they might have a gluten sensitivity?
So overall, gluten sensitivity is something that's kind of become this trend recently where, celebrities and many people are saying they feel much better since they cut out gluten and they've lost weight and all this thing. But we have to really distinguish between celiac disease and gluten sensitivity. So celiac disease is a true autoimmune disorder where when the person ingests gluten or they eat anything with gluten, they develop not only symptoms, sometimes no symptoms, but they develop inflammation of their small intestine. So that's different from a gluten sensitivity where they don't have any sort of inflammation reaction, but they just don't feel well when they eat gluten. So these are two different things. Sometimes people call it gluten intolerance, and then they differentiate that from true celiac disease. If you feel like when you have products that contain gluten in them, you don't feel very well, you may have celiac or you may just have gluten intolerance, but you need to figure out which it is, because celiac disease is a condition that you need to know about, because if you do have it and you're undiagnosed and you don't really stick to the diet, you can have some long-term complications from it. So my advice is to go to a doctor There's a simple blood test. That's the starting point for the diagnosis that can be done to see if you have celiac disease. Often it's followed up by an endoscopy, which involves, a little bit of sedation, and it takes about 10 minutes where a biopsy of your small intestine is taken just to see if you do have any inflammation or not. So, that's the situation there. I wouldn't just assume that you have celiac and go on the diet. First of all, that's a problem because if you do ever want to be tested, the test is not accurate when you're on a gluten-free diet. You actually have to have gluten in your diet to get a positive result. So don't try to diagnose yourself. Don't go on the diet yourself. The diet is actually not easy to stick to, and it can be expensive as well. So you certainly don't want to condemn yourself to that diet if you don't actually have, the diagnosis. So I would speak to your doctor. You can start with your primary care doctor about being tested for celiac disease. And then in terms of beers, some people think that all beer is, barley-based beer is gluten-free, but, there are some things that happen during the processing of beer that can involve gluten. So it is something that you need to check on an individual basis.
Thanks. The next question is about whether kefir comes in a non-dairy form. So I can speak to that. The actual definition of kefir is a beverage of fermented cow's milk. So, just like cow's milk was the only option for a while, and then we had soy milk and rice milk and almond milk and everything after that, we're sort of seeing similar trends with kefir. So even though it's defined as a fermented cow's milk, we're starting to see coconut water becoming fermented and having it be marketed as a kefir product, and a couple of other non-dairy products. So really, the only thing I would urge is just to make sure that the probiotic that product claims to have is something that's well substantiated for beneficial gut health. The next question is for you, Dr. Raj. It says, can overeating cause gas or constipation?
Overeating can definitely cause gas. Normally when we eat, our stomach expands a bit because, part of the digestive process that occurs in the stomach releases gas, and that will cause some distension in the stomach. So certainly overeating will cause that, to a greater extent. The other thing that can happen with quote-unquote overeating is people tend to eat very fast, and that can make you swallow a lot of air. So you're going to have more gas for that reason. Constipation, well, there are certain foods that when eaten in large amounts can cause constipation. Starches can do that for certain people. Some people actually get it with dairy, ironically, because most people get the opposite effect with dairy. But so depending on what you're eating and what your intolerances are, it can cause constipation as well.
Okay, thank you. The next question is something we've gotten before. It's, can C. diff be staved off with the addition of a probiotic? And I've certainly seen certain suggestions of that from certain clinicals that have been published. So again, I would recommend just Googling that, and you should be able to see what's been published publicly. Dr. Raj, do you have anything to add to that?
Yeah, I think that C. diff is one of the conditions that, has been actually looked at more than many other GI conditions in terms of preventing C. diff. I think, the case reports right now are fairly small, but they do suggest that probiotics may be beneficial. But I think that, larger studies are needed before we can kind of recommend for everyone to take them.
Okay, great. Someone would like specifics on choosing a probiotic strain, dosing, etc. And if you'd like to start, I can happily follow up.
Yeah, I think that I'm going to probably leave most of that to you, Ariel, but I think that, again, this is sort of a wide open field. We're learning a lot more about it, and there are different, it really depends why you're taking it, what you're taking it for, and I think the discussion should be with your doctor based on your individual needs and conditions, but I'll pass it over to you, Ariel.
Thanks. Yeah, so we get this question, and it's hard because we like to be able to provide a really black and white answer. But what is best, and what we believe is best, is making sure that, first of all, whatever the probiotic offering that you're looking at states, that the strain is really defined, and that you can then search for any sort of research that supports the benefit that they're claiming. So probiotics are just, it's a buzzword that we're starting to see on so many different packages, and it's a matter of really making sure to do your sort of the dirty work beforehand and making sure that whatever you choose is really a legitimate probiotic. So one thing is there are plenty of packages out there that just say live and active cultures, and those typically don't have a probiotic strain. They might have live and active cultures, but in order for a live and active culture to be to qualify as a probiotic, it must be able to survive the acidity of the stomach and then benefit the rest of the tract. So what we're seeing is a lot of people will assume that when they see live and active cultures, they're taking in a probiotic on a daily basis. But it's not actually the case because it's dying before it really gets to where it counts. So that's one definite thing to look at. The next thing is the dosing. So it doesn't necessarily mean that one probiotic or that all probiotics must contain, let's say, 20 billion like Good Belly's does. So each probiotic, based on its clinicals, will show the number of probiotic cultures that are required for daily consumption to be effective. So specifically when it comes to Good Belly, the clinicals on the probiotic strain that we use were focused on 10 to 20 billion colony-forming units for a daily dose. Again, I would just dig into each probiotic strain that is being offered to you and really understand what the clinicals seem to suggest based on that. The next question is for you, Dr. Raj. I have just been diagnosed with gastritis and GERD. What are the best foods for these disorders, and what foods should I avoid?
Okay, so gastritis is inflammation of your stomach lining, and GERD is gastroesophageal reflux disease, so it's commonly known as acid reflux. You know, a lot of people ask me what foods should I eat, and to be honest, there aren't a lot of foods that are good for or are going to really help your GERD or your gastritis. It's really more a question of what foods you do not be eating. So the stomach has its own natural healing mechanisms, and you just need to allow those to work. And the way you do that is by really trying to avoid the acid-producing foods. So those are anything with caffeine. And this is going to basically apply to both the GERD and the gastritis, because if there's too much acid, the gastritis is not going to heal as well either. So you want to avoid anything with caffeine, chocolate, tomato, citrus fruits, peppermint, alcohol, smoking, and the non-steroidal anti-inflammatory medications like ibuprofen and aspirin.
Great. The next question that comes in is, what effects do probiotics have with regard to stubborn belly fat?
I haven't heard any effects on that in particular. I do know that there is some research now, and I think I mentioned it a little bit, that part of the obesity epidemic that we're facing now is due to an alteration of the bacteria in our intestine. That certain bacteria that we've gotten rid of because of antibiotics, H. pylori being one of them, may actually have some effect on our hunger hormones and our feeling full hormones, or satiety hormones. So there definitely may be a link, there may be a link between the bacteria in your intestine and how much you eat and whether you gain weight, but I think it's too early to say exactly what that link is.
Yeah, to piggyback on your statement, Dr. Raj, we have heard plenty of people reach out to us with regard to this question, and it seems like the media is starting to discuss this potential link between probiotics and fat loss and weight loss. So what I'd actually like to be able to offer is sort of an analysis of what's going on out there with regard to research and put it in an upcoming e-newsletter. So make sure you're subscribed if you can, and we'll get back to you on that. Then the next question is, when I have an upset stomach or heartburn, I take Tums. What do you recommend to avoid heartburns? Is this the right approach?
Well, Tums works as sort of a Band-Aid solution where once you get the acid reflux, if it's a mild form of it, Tums can help neutralize it. However, the ideal situation would be to not have the acid in the first place, because when you are feeling that acid reflux, it's coming up in your esophagus and it's potentially damaging your esophagus. So really going back to the diet that I recommended, the foods to avoid, but also certain lifestyle things that we didn't talk as much about. So having more frequent smaller meals as opposed to 3 large meals. When you eat a large meal, your stomach distends. That can push acid up into the esophagus. So you want to try to avoid that. You don't want to eat late at night and then go right to sleep. So you want to be upright, sitting up or standing up for at least 2 to 3 hours before you lay down after a meal. Those things can help as well. For people who get nocturnal symptoms, having the head of the bed elevated so that they're actually sleeping at an incline so that gravity can help the acid go down as opposed to going up towards the head. These are all things that can help prevent acid reflux.
Great, thank you.
And I just want to mention, too, if you are taking Tums often, if you find yourself requiring it even as much as once a week, that means that, you do have a serious condition and you need to talk to your doctor about it, because you may actually be causing damage to your esophagus.
Okay. Another question came in that we've also received. It says, any insight on if Good Belly might benefit children's eczema or wheezing? So again, that is a condition, so we can't specifically state Good Belly as improving that, but generally speaking, from the probiotic standpoint, it is sometimes seen as an anti-inflammatory. So what can happen is if eczema or wheezing or even acne we've seen are the result of some sort of inflammation happening in the body, it can be seen that probiotic intake on a daily basis can improve those considerably. The next question is, let's see, will probiotics help with lactose intolerance?
Again, I think that's a condition as well, and I don't know if it's been well studied. Lactose intolerance is a condition where you don't have enough of the enzyme lactase to digest lactose. So when that happens, people often get bloating, diarrhea, they feel uncomfortable. So I don't know, Ariel, if you've heard of any connection there, but I'm not aware of it.
I don't think I can speak to that. I know that plenty of people are lactose intolerant and looking for a lactose-free form of probiotics, since they often associate probiotics with dairy. And so as soon as they try Good Belly, since it's a probiotic that's completely dairy-free and vegan and soy-free as well, they all of a sudden are finding really, to be very pleased with their experience. So that's the best I can give you on there. I'm sorry to not
okay, yeah.
Then we have, is there any research on probiotics and bone loss in post-menopause? Bone loss has been shown to be tied to problems with the gut.
Not as far as I'm aware of. I'm not sure if you've heard anything, Ariel, but not as far as I'm aware of.
No, and you know what, we're getting a lot of questions about research around probiotics, and what I love to see is that probiotics are being just heavily researched more recently than ever before, because they're seeing such benefits associated with them. And so what I have a feeling about is just as the years progress, we'll have a lot more insights regarding the overall benefits of probiotics regarding certain conditions that are being mentioned and requested.
Mm-hmm.
So we have so many more to get through, and we only have about 5 minutes. So what I'm just going to say is we'll answer a couple more questions, and then if anyone didn't get their question answered, we will email you a response, okay? So I want to make sure that everyone feels completely listened to. We are receiving them. Okay, let's see. The one question is around what to do about the Good Belly 12-day challenge after you're done the 12 days. So just as a background, we offer a satisfaction-backed guarantee. We call it the 12-day challenge because we offer a discounted supply for the first 12 days if you sign up at goodbelly.com for the 12-day challenge. What you'll do is just provide your information right there. We will immediately email you with coupons for a discounted supply, and then we'll check in with you throughout those 12 days. If by day 12 you don't absolutely love Good Belly, then we will refund you for that supply. And so some people will get to day 12 and then think that's it. But what that really is it's just a chance for people to try Good Belly, you know, really with no risk. So once you're happy with the results, then you can always move forward and drink it on a daily basis, which is suggested. Because what happens is the probiotics will get depleted in your system if you don't keep going. That is, we've gotten a few questions regarding that actually. Let's see if I'll find one last question. So, you know what? Let's see. One question is, it's really interesting. Okay, it's a long one, but I'm going to get to it because I think it's fascinating. This person said, "Hi Ariel, this may sound like a testimonial for Good Belly. As a retired clinical microbiologist, I have the following question. Could you please ask Dr. Raj if she has seen any patients that suffer adverse effects from using probiotics that contain specifically a Lactobacillus acidophilus, which Good Belly does not contain? I have experienced unusually large amounts of gas and foul-smelling gas when I ingest Lactobacillus acidophilus specifically. Good Belly has been a great probiotic for me. I don't even like to eat yogurt made from almond or coconut milk because the cultures used cause undesirable effects." Would you be able to speak to that, Dr. Raj?
Yeah, you know, I have had a couple patients, honestly, with, you know, different probiotics having some ill effects, things like increased gas or increased diarrhea. And I think, you know, like anything in medicine, everyone's body is a little bit different and can react a little bit differently. So I haven't found more so with one particular strain than another, but I think that while generally probiotics are extremely safe, you know, once in a while, and generally either they'll help someone or they won't cause any effect. Once in a while, I will see a patient who doesn't feel well when they take a probiotic, and then we just switch them to another one. But I haven't found a direct correlation with a specific strain, no.
Okay. Well, thank you again for signing on and for being a part of our ever-growing community. I wanted to let you all know that this has been recorded, and we will be able to provide access to a downloadable version of the webinar in case anyone had to skip out quickly or had to miss it for any reason. So thank you again, and I hope you all have a wonderful, happy holiday season, and please be in touch. We always love to stay in touch. Thank you, Dr. Raj, for your time as well.
Thank you so much.
Take care, everybody.